Hello everyone, I'm Noemi Ivy Melencio, registered nurse, an intensive care unit nurse, and I will be discussing with you about cancer, breast cancer in particular, since it's the most prevalent and actually the most common cancer that we have here in the Philippines. Actually, among Asian countries, Philippines has the number one incidence of breast cancer, and 3 out of 100 women will actually get breast cancer at the age of 75, and 1 out of 100 will actually die before the age of 75. So, breast cancer accounts for 15% of all new cancer cases in the country for both sexes and 8% of all cancer deaths. So, actually, breast cancer is, if detected earlier, you will have a good prognosis. That's why we are encouraging or we are teaching women especially to do self breast examination. So what is self breast examination? It's actually what we do when we assess by palpation or when we examine our breast like every month. So when is the best time to do self breast examination? It's actually done at least or during the 7th or the 10th day of your cycle. You can do it while lying down or even when you're taking a bath and you're standing. So what do we do while during breast self examination? So we are palpating our breast in different pattern. It's either we do it in a circular motion from in going out, or we can palpate it from up down, up, going like that, and or even we can do palpate it from inward going outward. So it's when during palpation we will find some unusual things or lumps that we have in the breast. So it's better that we do it regularly, and if we see something unusual, it's better to refer it immediately to healthcare professionals or to our doctors. So but this most like in every regular examinations, like medical examinations, our doctors or the physicians can actually do the breast examination with you in you. So what are the risks of breast cancer? We have actually a lot of risk factors in having breast cancer. So we have the age, the family history, we have clinical history, late first pregnancy, prolonged hormonal exposure, and lifestyle factors. So with the age, a majority of breast cancer cases actually occur in women over the age of 50. And for the family history, if a woman has a personal or family history of breast cancer, like if her sister, her daughter, or mother has had breast cancer, then he has a greater risk of having one. Clinical history, so women who have previously suffered from with benign breast cancer are at greater risk of developing breast cancer in the future. And another thing is late pregnancy, late first pregnancy, or if you like, you got married, you got pregnant at a later age, like age after 35, then you're more likely to develop you're higher risk of developing breast cancer. Another thing is prolonged hormonal exposure, so a long menstrual life, or possibly use of hormones or hormonal replacement like pills, or hormonal replacement therapy after menopause will expose women to an increased risk of having or of developing breast cancer. And another is lifestyle factors, for example, being overweight or obese after menopause, like physical inactivity or sedentary lifestyle, like a high fat diet and high alcohol consumption, can play an important role in the development of breast cancer. So these are the risks. Then this risk can be or can't be modified. So like lifestyle factors, this can be modified. So we just have to follow a healthy lifestyle in that. So what is uh what is the pain in breast cancer. Like for us women, we might think, oh my god, I'm maybe having a breast cancer because I have like breast pain. But we should not confuse the cancer pain from the hormonal changes caused pain. Like for us women, it's very common that before menstruation we would experience this pain in our breast, tenderness in our breast, but it's different from cancer pain, because according to the patients, the pain from breast cancer is really sharp. It's really sharp and shooting. So it's it's because of the lump, probably. The lump is causing, or is already getting bigger, and it impedes the other structures in the breast. That's why it's causing that sharp shooting pain. So it's totally different from the pain that we are experiencing before our menstruation or even after menstruation. So what are the signs of breast cancers? Usually, a patient would see and come a physician or a doctor if he notices something different or unusual in her breast, like a lump, nipple changes, discharges, and all. So, to be more specific, um, signs that we can from breast cancer could be a hard lump developing the breast or in the armpit. Typically, it's painless and it's occurring on one side only. A change in the shape and the size of the breast, including indentations, growing particularly, or prominent veins or skin erosions. Like if you see something bothering you, like there's a wound, unusual wound in there, so it's better to have yourself checked. Changes in the skin, such as hardening, dimpling, bumps, redness, heat, or an orange. The most common is the orange peel-like appearance. They said it looks like an orange peel. That's why if you notices that one, it's better to have again yourself. You have yourself checked again. Changes in the nipples, such as retraction, secretion of unusual discharge, or a rash around the nipple area. So these are the common things that we have to watch out during our breast self-examinations, and it's better to have ourselves checked whenever we see these unusual changes in our breast. So um what are the signs? So those are the signs of the breast cancers that we have to watch out for. So how are these diagnosed? Through self breast examination, or even during doctor's examination, or during procedures like mammography and all. So it is very important to take note of all these things. How can you lower the risk of breast cancer? So yes, we can lower our risk of breast cancer, especially for those modifiable risk factors that includes the a healthy lifestyle, and that includes exercise and avoidance of alcohol and even alcohol and cigarette smoking. So another question that we can get is, can men get breast cancer? Yes, there are cases of men who gets breast cancer, though it's most common in women, but men can have breast cancer too. Why breast cancer awareness is important? Breast cancer awareness is really very important in order for us to be able to detect cancer earlier. Um, it's a cliche, but an early detection really saves lives. So women who notices changes in their breast should have their self checked, to the proper to go see a doctor and see for proper assessment, and most probably proper management, because yes, cancer, breast cancer, if detected earlier and managed earlier, has a better survival or a good prognosis. So those are the things that we should take note. What are the treatment for breast cancer? Most of the things, of course, if we have the lump there, if it's detected earlier, we can have the lumpectomy, or even if it has we can even have do mastectomy. They can have partial or simple mastectomy, or they can have radical mastectomy, or it's the removal of the breast. Together with it, they would you may probably need radiation therapy, hormonal therapy, or even chemotherapy. But that's why early detection will have a good prognosis if it's detected in an earlier stage. So those are the things that are very important in breast cancer. So we have actually questions like there are myths and facts about breast cancer. So we will tackle some of this. They said that breast cancer only affects older women. So the fact is, all women are at risk for breast cancer, but the incidence rate of breast cancer increases with age. So, all women are at risk for breast cancer. We have to take note of that. If a woman has a family history of breast cancer, she will also have it. So, it's one of the myths. So, most women with breast cancer have no family history. So, the fact is, it's like that. We don't have family history, but women may be at higher risk if, like what I've said, if her mother, her sister, her daughter have had breast cancer, so they have a higher risk. Women who have more one risk factor will probably have breast cancer. So that's one of the myths. But the fact is, most women diagnosed with breast cancer has no risk factors aside from their sex and ages. So that's it. Another thing is breast cancer can be prevented. Actually, there's no definitive way to prevent breast cancer because until now, the cause is still unknown. The cost of breast cancer is still unknown. But as we have said, we if we will be able to adopt a healthy lifestyle, it can help minimize our risk. Another myth is drinking too much coffee increases risk of breast cancer. The fact is there's no relationship between coffee and breast cancer. Deodorants can cause breast cancer. The fact is no relationship between deodorants and breast cancer. Another thing is mammogram exposure exposes women to large quantities of radiation, and this can cause breast cancer. It's a myth because the fact is the radiation that is used in mammogram is very minimal, and it's food and drug administration approved. So it's really safe. So another myth is wearing a bra causes breast cancer. The fact is underwired tight bra don't stop lymph drainage, so it cannot cause breast cancer. A myth: getting double mastectomy will save me from getting cancer. Um, it uh, it may still surface in the lymph node, so it doesn't mean that if you have removed your breast, you will not have you will were able to get rid of the cancer because it could probably have traveled in your lymph nodes. So those are just some myths and the facts about breast cancer, and I hope that you have learned so much from this. And just a takeaway, early detection saves lives. So learn how to do self breast examination, learn to have yourself checked if you see some unusual changes in your breast, because this can actually save lives. So I hope you have learned some from this discussion, and be able to share it with other people too. Thank you so much.